Hi, this is Dr. Kazmi. Today we're talking about one of the most important topics in diabetes care: insulin and its types. As you already know, there are different types of diabetes, caused by different reasons. In type 1 diabetes, the body produces no insulin at all. That's why people with type 1 need insulin injections from the start, because insulin is necessary to control blood sugar and keep the body alive. In type 2 diabetes, the problem is insulin resistance. Here, the body makes insulin, but cells don't respond properly. So treatment starts with lifestyle changes, a healthy diet, and exercise. And then oral tablets, which work in different ways to improve insulin sensitivity or increase insulin release. But over time, many people with type 2 also need insulin. Insulin is a natural hormone, produced by beta cells in the pancreas, specifically in the islets of Langerhans. After eating, when your blood sugar rises, the pancreas releases insulin. Insulin helps sugar enter body cells to provide energy. It also lowers blood sugar levels in the bloodstream. In the body, insulin has two main patterns: basal insulin, the background insulin that controls sugar between meals and overnight, and bolus insulin, the quick-acting insulin released after eating to manage food-related sugar spikes. The discovery of insulin was a medical breakthrough. In 1921, Frederick Banting and Charles Best in Canada successfully extracted insulin for the first time. It saved millions of lives worldwide. Early insulins were taken from animal sources like pigs and cows. Later in the 1980s, with the help of recombinant DNA technology, we developed human insulin, created in labs using bacteria. Initially, we had regular, which is short-acting insulin. Then there's NPH, which is an intermediate-acting insulin. Later, new technologies introduced rapid-acting insulin and long-acting insulin. There are also ultra-long and combination insulins now, and research is ongoing on inhaled insulin for children and other new delivery methods. So, let's break them down. Rapid-acting insulin includes examples like Lispro, also known as Humalog, Aspart, which is Novorapid, and Glulicine, or Apidra. This type is given right before meals or, immediately after. It starts working within 10 to 20 minutes, peaks at about 1 to 2 hours, and lasts around 3 to 5 hours. The benefits? Quick sugar control after meals, and usually there are fewer low-sugar episodes between meals. Short-acting or regular insulin, for example Actrapid, is given about 30 minutes before meals. It starts working in 30 minutes, peaks at 2 to 4 hours, and can last up to 6 to 8 hours. This type is good for planned meal times and for people with pretty predictable eating patterns. Okay, let's talk about intermediate-acting or NPH insulin. Some common examples are Insulatard and Humulin 1. This type of insulin usually starts working in about 1 to 3 hours, peaks somewhere between 4 to 8 hours, and can last up to 12 to 16 hours. It's mainly used as a background or basal insulin, and, it's often combined with short-acting insulin to help keep blood sugars steady throughout the day. Now, moving on to long-acting insulin. Examples include Glargine, which you might know as Lantus, Datamir, also called Levemir, and Degludec, which is Tresiba. These start working in about 1 to 2 hours and provide a steady level of insulin for up to 24 to 42 hours. There's really no significant peak, which helps reduce the risk of low blood sugars. The big benefits here are fewer injections and more consistent blood sugar control, which is definitely helpful for a lot of people. And finally, let's discuss combination or pre-mixed insulin. Some examples are Humalog Mix 25 and Novo Mix 30. These contain both rapid and intermediate insulin, making them a good option for people who prefer fewer injections. They're usually given twice daily, which can make managing diabetes a bit simpler for some folks. So, usually insulin is injected under the skin, which we call subcutaneously. Common sites for these injections include the abdomen, thighs, upper arms, and buttocks. It's really important to rotate your injection sites, to avoid skin thickening, or what we call lipodystrophy. Alright, so keep unopened insulin in the fridge between 2 degrees and 8 degrees Celsius. Once you open it, you can keep it at room temperature for up to 28 days. And just remember, do not freeze insulin. Freestyle Libre and continuous glucose monitoring, or CGM, mean no finger pricks. Just scan and check your sugar. Insulin pumps deliver continuous insulin under the skin, mimicking the pancreas. Inhaled insulin is still under research, especially for children with type 1. Intravenous insulin is given in hospitals for emergencies like diabetic ketoacidosis. Hypoglycemia or low blood sugar can happen with insulin. Symptoms include sweating, shaking, dizziness, and confusion. Weight gain can also occur because better sugar control stores more glucose as fat. Insulin is life-saving for millions of people worldwide. Understanding which type you're on, how it works, and how to use it safely is really key for long-term diabetes control. Thanks for watching. Please like, share, and subscribe. For more detailed information on diabetes management, join Smart Living with Diabetes by Dr. Kazmi. For general health topics, check out Health is Wealth by Dr. Kazmi. Your health is your wealth. See you in the next video.